Can you tell me what happens to a patient after surgery and how that affects us?
Well, after surgery, the patient spends time in the post-anesthesia care unit, or the PACU, and from the PACU, the patient is transferred back to their room.
And then what?
Then we can focus on any actual problems or anticipated problems that the patient may be at risk of developing.
Good. I tell you what, let's take a break, and we'll meet back together later.
Yeah.
Sounds good?
Sounds good.
Okay.
I'll see you later, Miss Scott. Thanks.
All right.
Miss Scott, how'd she do?
Oh, Mark. The surgery was successful. Oh, she's
Good.
now spent 2 hours in PACU recovering from anesthesia without any complications, and she's on her way back to her room.
Okay.
Now, while you're here, tell me, what's the first thing we're going to do?
The first thing I'll do
Yes.
is help the transport person in transferring the patient back into her bed.
Very good. Well, I tell you what, just follow me, and we'll get her set up, and we'll obtain a report from the PACU nurse, and we'll review the OR and PACU data, and then assess her.
All right, I'm with you.
All right, let's go. Okay. Mrs. Rogers, you're back in your room now. Hello, Mrs. Rogers. Okay.
Hello, Mrs. Rogers. Hi, this is Mark, your nursing student. We're just going to get you comfortable in your bed now, okay?
Okay.
All right.
All right, let's get her over. All right, let me get up here a little bit. And support her shoulders. Yeah, we should put her head. Okay, on the count of 3. 1, 2, 3, and over. Very good. Okay, Mark, while we're doing this, can you tell me how we position her in her bed?
In a safe position.
Good.
Either the semi-Fowler position or the side-lying position.
Very good. And tell me, how often do we take her vital signs?
That would be every 15 minutes for the first 30 minutes, and then every 30 minutes for the next 2 hours, and then every hour for the next 4 hours, and then every 4 hours.
Good.
But I would check with the hospital's guidelines.
Very good. Now listen, what we're going to do is pull her up in bed first.
Okay. Mrs. Rogers, we're just going to move you up in the bed now.
On the count of 3. 1, 2, 3, and up. Good. There we go. Now let's make sure she's nice and warm.
Does she need another blanket?
Yeah, here's one right here. You see, it's very cold in the operating suite, and the things that they were doing to her, many of the interventions caused her body temperature to lower, you know? Let me put this on here. Now, what I want you to do is to be sure to assess her skin color.
She is a little
and
pale.
condition. Yes, she is.
But her skin is warm and dry.
Good. We need to check the dressings for color, odor, and amount of drainage, okay?
Okay.
All right, so go ahead and do that.
All right.
Good. All right.
And we should mark any drainage on the dressing for future comparison,
That's right.
Okay.
Now, why don't you feel and look up under the patient and see if there's any drainage coming from the incision site, any bleeding, anything.
Okay. Are you feeling any pain, Mrs. Rogers?
No.
Okay.
Okay, good.
All right.
Okay, we will also verify that the tubes and drains are patent, if there are any, which there aren't.
Okay.
And we also want to check that any equipment is in place and operating properly, all right?
All right. And we should also check the IV solution rate.
Right, right.
And make sure that the IV infusion is at the prescribed rate.
Good, good. And be sure to monitor her urine output.
Okay.
Okay, is the bag placed right? Okay.
Yep.
And output's okay?
Yep.
Okay, now tell me this, did we provide a safe environment for this patient?
Well, the bed is in a low position.
Okay.
The side rails are up.
Good.
And the call bell
I'll put it there. All
easily
right.
within reach.
It is.
Mrs. Rogers, we'll be back to check on you in about 15 minutes. So if you need anything, you just ring that bell, okay?
Hi.
How's she doing?
She's doing okay.
Okay.
David, if you need anything or you have any questions, you just ring that bell and we'll be right up to help you.
Can do.
Okay. Mark,
Baby.
let's document our assessment.
Okay.
Good.